November is National Family Caregivers Month, and in my practice, I see a lot of patients with Alzheimer's and other types of dementia, and I spend a lot of time talking to their family members, whether they be spouses or children, other family members or friends. And if you are the primary caregiver of somebody with Alzheimer's or dementia, you know the stresses that it imposes upon your own life. Here are 5 things that I recommend any caregiver for a patient with Alzheimer's look into that might be able to help you and help you help your loved one. Number 1, learn about the disease. Talk to your neurologist, do research about Alzheimer's, learn why it happens, learn about a typical time course of progression, learn about all the treatments or potential treatments and all the things out there that could potentially slow the disease down. Number 2, take a break and get some respite care. I've seen so much caregiver burnout because caregivers feel a heavy responsibility that they need to take care of their loved one, or they feel guilty if they're not there taking care of them. And that burnout just actually, worsens overall care, and it's not good for the patient. You can't take care of your loved one if you don't take care of yourself. There's so many options here. You can recruit friends and family members to come in and take care of some of the responsibilities, to take some of the load off. Many of my patients' caregivers have actually found and hired private, essentially companions. They've gone to places like care.com, carelistings.com, eldercaredirectory.org, and these are sites that have vetted essentially companions that can come in, spend time with the patient, take them for short trips, maybe run some errands, go out and make the patient feel like they're being very sociable. In the meantime, taking a lot of burden off the caregiver so that you can get a break, you can take care of yourself, you can go for a walk, and this can be really, really helpful for the overall care of the patient. Number 3, find support groups. It is so valuable to meet other people who are going through the same thing that you are. Number 4, take advantage of professional caregivers. These are home health nurses, home health therapists, people who can come into the house and take care and manage the medical management. They can come in and help administer medications, give insulin shots, those sorts of medical things that sometimes caregivers are not quite trained or feel comfortable taking care of. And the 5th thing, maybe the most important thing, is plan, plan, plan. Create a long-term plan as early as you can after the diagnosis is made. This plan is going to include if and when a patient should move into a higher level of care like a memory unit or a skilled nursing facility. It's going to include things like end-of-life care. It's going to include things that regard the finances and estates and things like that. Kicking that can down the road causes tremendous emotional, psychological, and a lot of times financial pain unnecessarily when it should really be taken care of as soon as possible, as uncomfortable and as painful as that is. So as a neurologist, I thank you, the caregiver of our patients with neurological diseases like dementia. They are not diseases that affect just one person. They obviously affect entire families and social support structures and communities. It's not easy. Find a neurologist that will help guide you through these 5 points and many other points that can help you take care of yourself and help you take care of your loved one. Thanks a lot.